the services that were doing really well gave a higher average dose of treatment. So it's just like in medication, there's a dose response effect. But the optimal number of sessions, the average number, was not enormous. It was about 10 sessions, although obviously some people get many more, some people get less. We also find that how long you wait before starting treatment was important. So those services which on average could get you started in your treatment within 6 weeks at maximum, got particularly good results. Those that had a longer average wait before the start of treatment, although they were offering essentially the same treatments, the outcome rates were not as good. So it seems that there's a sort of moment of opportunity we have. I think coming for psychological treatment is quite a challenge for people. They know they're going to have to discuss some difficult things. They're going to have to work with their therapist quite hard on those issues. And I think when they're referred, they're open to that. But that's a window of opportunity which won't always stay there. So that's our interpretation of the data, at least. The other thing is, it does seem very important to follow the clinical guidelines. So early on, we had quite a lot of therapists who were aware of the clinical guidelines, but would do something slightly different from the clinical guidelines sometimes. And of course, because we have the data, we can look at whether patients benefit from that slight difference. And we found in general, they didn't. So, for example, NICE recommends counseling and cognitive behavior therapy for depression, and we got identical outcomes for the two. But for generalized anxiety disorder, NICE recommends cognitive behavior therapy, but not counseling. But many of my counseling friends said, but we know we do well with patients with generalized anxiety. They were right in the sense that we got 48% of people with generalized anxiety to recover with counseling. But what they didn't know was that with cognitive behavior therapy, it was 58%. And we found this many times, that following the guidelines in terms of evidence-based treatment gives us better outcomes. And that compliance is now much better in the system, of course. We also found that some services have quite a lot of patients who have a scheduled appointment, but then don't turn up, what we call DNAs. Those services, again, had less good outcomes, but we could change that really quickly by encouraging them to use SMS reminders for appointments, and then their DNA rate went down and their outcomes went up considerably. And the last key feature was doing a good assessment, and we found that those services that were good at identifying the key problems they're going to treat get much better outcomes.